John Stuart Reid is the inventor of the simoscope, and he's doing a lot of research with blood, but also research on pain. So let me play this video for you. Here we go. Okay, check this out. Yes.
Okay, so pain, the physiological mechanisms, and sound therapy mediation. So this subject is actually fairly simple to understand from a, why is this not working? Hang on. Let me try it this way. Okay. Yeah, it's fairly simple to understand. So, but let's just begin by saying that acute pain is in fact a vital function of the body, provides early warning of damage or potential damage. And while diagnosis and treatment of the underlying root cause of pain, of course, is important, it's also important to say that unmanaged pain can lead to changes in the nervous system that could ultimately reduce its responsiveness to treatment. Now, we come first of all to the role of nociceptors in acute pain mediation. I'm not going to read all of this because you can later read it yourself because David will have this presentation. However, the point is that over your body there are thousands of these little nerve endings called nociceptors, and although the brain itself doesn't feel pain because there are no nociceptors located in the brain tissues, nociceptors nevertheless respond to damaging stimuli. So they are, in effect, they are the body's early warning system. And they connect with three different types of afferent fiber. These are A beta, A delta, and C fibers. These different types of fibers, they operate at different speeds in the body, and they have different roles. But crucially, the most important thing here from this presentation point of view is that all three types of fiber are susceptible to mechanical pressure. They all activate with mechanical pressure. And so this is why when we experience physical trauma, our innate sense causes us to tightly hold the area, creating mechanical pressure, which mediates the pain. But of course, it's also mechanical pressure is one way to describe sound. That's what sound is. It's a type of mechanical pressure. And it's why sound of the correct frequency can in fact mediate the pain. So here's a guy who's just, hit his thumb with a hammer, and we all know how painful that can be. But, when he does that, his immediate sense is to hold tightly onto that area of his body, his thumb, and that will significantly reduce the level of pain, just as sound will do if we use the correct frequency. Here's another slide that I'm not proposing to read, but basically you can see it tells you all the different speeds of conduction of signals through the nervous system. And I also should mention that pain can be mediated by other means, which we'll get to in a moment or two. This is a really interesting aspect to the conduction of nerves. Do nerves conduct electricity or sound? I think everyone would immediately say, oh, they conduct electricity. But in fact, the opposite has been found to be true. So this slide, says, have you ever wondered why nerve conduction velocity is so slow relative to the speed of electrical impulses, which of course are measured in nanoseconds, while nerve signals are measured in milliseconds. So have you ever wondered why that is? Well, I had, but these researchers in the Niels Bohr Institute did some experiments, and what they found basically was that nerves actually do conduct sound. Where the electricity comes in is because there's a piezoelectric effect in the nerves, and it's this piezoelectric effect that creates the electricity that then goes to the brain and obviously is interpreted in the brain. but the nerves actually conduct sound, and this is obviously has huge implications for sound therapy. And here is one of the papers on this subject, which you could look up, you know, if you really want to go into some depth on in this subject. But essentially, this discovery does have significant implications for sound therapy and music medicine. There's also a gate control theory of pain, which we can talk about a little bit. But before we get to that, here's the cross section through the spinal column. And you see that the gray matter of the brain actually travels right throughout the whole of the spinal column. And it's on the left-hand side there, this dorsal root ganglion is where all of the pain signals go from the nociceptors that I've just been talking about up to the brain, where they are interpreted as pain, the early warning system that we talked about. So here's a quick summary. Mechanical stimulation of A beta fibers by mechanical pressure or by specific sound frequencies activate inhibitory neurons in the dorsal horn, which I've just shown you. Once activated, the inhibitory neurons, which sit on the same path as the projection neurons, mute the pain signals before they reach the brain, effectively mediating the pain. And there's a very nice diagram showing this.
So it seems like there's multiple places you could really focus on. You can focus on the receptors, you can focus on those nerves going up, you can focus on that gate there. And even the brain, right?
Yeah, absolutely, absolutely. But the primary mechanism, David, the primary mechanism are these nociceptors, and the fact that they all are susceptible. They can all be triggered by sound, and that Niels Bohr Institute research is crucial, or is key to this whole question. Now, here are some various frequencies that have been associated with pain mediation. I'm not going to, at this point, say where they all came from, but you know, I have references for all of these, where they came from. So just a quick notice that some of them are in the very low frequency areas, such as 16, 25, and 50. Some of these, by the way, relate to the cat's purr, where the low frequency sounds of a cat's purr were discovered to be healing. You know, some scientists recognized that a cat purrs when it is damaged, when it's, you know, been hit by a car or whatever. It will purr and purr and purr and purr. And they reasoned, why would a cat purr? It's using energy, so why would any mammal do that unless there was a reason for it? And what they discovered was that these low frequencies actually do stimulate not only bone growth, but also soft tissue injury is supported by these low frequencies. The other higher frequencies come from different places, different science, but we don't have the time now to go into it all, but at least I thought I should give you some of them. And then at the end, there are frequencies there related to reduction of inflammation. So just for completeness on this subject of pain, there is a second system of pain mediation available to humans and probably to all mammals. So the periaqueductal gray ventromedial medulla are two important areas of the brain involved in descending inhibitory modulation. Now, both of these centers contain high concentrations of opioid receptors and endogenous opioids, which help explain why opioids are analgesic. So what happens is descending pathways project from the midbrain to the dorsal horn, which I showed you earlier. And these descending pathways inhibit pain transmission. And this is the critical part. During periods of psychological stimulation, such as strong emotions, which can be aroused by the music we love. So basically, any strong emotion can inhibit pain. And one of the beautiful ways of that is to immerse ourselves in the music that we love. Now, that will not remove pain entirely, but it will mediate the pain, because what it does is it creates natural opioids in the midbrain, which then cause pain to be inhibited or mediated, you could say.
Do the opioids do it in the brain, or do they send it all the way down to the receptors?
They send it right down to that ganglion that I talked about earlier, and therefore block the pain at that point. And that's all part of the gate control theory of pain. So the descending pain modulatory system may be why patients who listen to music that they love report less pain than patients who do not listen to music. There's another section to this presentation that we don't have time for today, but all concerning music medicine, which of course is a new term in clinical medicine today. It's now generally accepted that the experience of pain does not solely rely on noxious inputs, but many variables interplay with the experience, including memory, mood, environment, attention, and expectation. And ultimately, this means that the resultant pain experienced to the same sensory input can vary considerably. And I just thought I'd end with this beautiful little hand drawing of a spine. I didn't meet this guy, Dr. Theo Gimble, but I met someone who was handling his trust. He's now passed over. But Theo Gimble did something extraordinary, David. He took some human spines, both from male and female, and he weighed every single vertebra and then checked the ratios between the vertebrae and found that all of the vertebrae in the spine were in musical ratios. So this brings us back to, you know, the human condition as being very resonant with music. I just love this. I love the whole concept that nature has provided music even in our spine. So you know, there's a lot more to this subject. Obviously, I've rattled through that. I know, because I know you didn't have much time today. I'd love to spend more time, you know, discussing this subject in more detail with all of your followers. So another time, but I hope I found that an interesting little introduction to the subject of pain in relation to sound and indeed music.
Someone years ago told me, one of my students said there's a research project that shows that the spine is based on harmonics, and it's exactly what this is showing. And I'd never saw the data behind it, but I've always put it out there thinking, is it really true, right? Because the harmonics, it's showing like a violin, a harmonic structure, right?
I know, it's absolutely extraordinary. I was blown away by this, actually. And so, you know, good on Theo Gimble. And one of the stories relating to him, by the way, if you've got time just for a moment, I'll share with you, is that he was German, and he was conscripted into the German army, you know, for the World War II. And he was sent off to the area of Russia, one area of Russia, where ultimately he was captured and tortured, as a lot of his colleagues were. He was the only guy who was ultimately set free, even after the torture. And the reason why he was set free is because even with the best torturers that the Russians had to offer, they could not break him. Where all the other guys in his unit that were captured, they all gave the information and then they were all just shot, unfortunately. Theo was not, you know, Theo did not spill any beans, as it were, because he surrounded himself with what he said was Christ energy. And that actually prevented him from, you know, from giving up any information. And that's why they said, even with our best torturers, you have not given any information away, therefore you can go free. I think it's a wonderful story.
I love it. Okay, so I've got a couple of big questions. You know, it seems like there's all different types of pain, right? I mean, there's localized pain, there's systemic pain. Any idea of the overall categories of pain? Are there like, is there a certain categorization of types of pain that you know of?
Well, of course, but it is a hugely complex subject. And, you know, I'm not a physician myself. I've studied, of course, sound therapy for over 20 years. So, and I understand that pain be mediated by some of these mechanisms that we've talked about today. But pain is a hugely complex subject. And, I'm certainly not an expert in that area, David.
Cool. Now, on that list of frequencies, are those frequencies divided up into different types of pain, or are they just for, because, it's interesting. When I was in the hospital and I had appendicitis, the worst pain was when they would pull the tape off of for the IV, right, pulling my hair. And I would just scream, right? And I would feel no pain. And finally, the nurses came in and said, "You're freaking the people out down the hallway. You have to stop that." And so I talked to the doctor, and the doctor said, yes, when you fill the nerve endings up with sound, there's no more room for pain, right? And I learned that you don't have to scream. You can actually just tone, right? So any sound will fill up those nerve receptors, right? So, and then, mhm. And then when I was in,
yes.
Go ahead.
Yeah.
Okay, when I was in Mount Shasta, I had, I've played with different tuning forks, and I haven't done an exhaustive test at all, but I found 108 hertz works really well on burns and on bruises. And I have no idea if that's exactly the main frequency, but I found that like 54 hertz didn't work so well, and higher frequencies didn't work well. So in that range. And so it seems like if we could categorize maybe even just generally 4 or 5 types of pain, maybe there's a way to categorize it. So I'm going to be looking for someone that can help, a doctor that can help us with that. Then we can say, okay, now we can go forward with the research and see what frequencies or combinations of frequencies or even music through that system will actually mitigate pain. And it seems like this is not rocket science, right? This seems like one of the lowest hanging fruit that we could do with sound, right? Because the potential, because I've already seen such amazing results, much less just distracting people with, a little music, right? And creating the.
Well, no, David, it's not really distracting. The whole thing is, when we talk about the role of music here, and it has to be music that you love, not just any music. But when we talk about music that we love, this is coming into the gate control theory of pain, which shows that when you have any extreme emotion, then that will inhibit the pain. So what that slide was showing that I showed there was that music, of course, can induce an extreme emotion of bliss, of course, but any extreme emotion, such as you screaming, right? Okay, you created sound, and that would have its own impact on on your nervous system, but also it was affecting it was creating opioids in your midbrain.
You just froze for a second.
It was, you screamed and you felt the pain, but that was also extreme emotion. So therefore you had the opioids and you had
But do the opioids actually just stop the pain, or do they actually get into the nerves and actually repair them? Because that's a big difference.
No, they don't.
Right.
Yeah,
I wouldn't think so.
They don't repair the pain, right?
Right.
The whole idea, of course, is that pain is important to the body. As I mentioned in the first slide there, it's important in order to alert us to some potential damage in the body.
Yes, but if you've got nerve.
Pain,
I'm sorry. I'm going to go ahead and stop it now. So breaking up. Keep going.
Go ahead.
Okay. So what I get from this is this. There's 3 different areas to work in. One is you can work at the brain level, right? And do things that will create opioids. or distract, right? Or possibly, you know, I mean, if you meditate in certain ways, you can totally overcome pain, like he was talking about with the guy on war, right? Or you can work at the receptors and the nerves that actually transmit the pain to the brain, right? And those, I think we can work with sound really easily, because the basic concept is fill the nerves up with sound, and they don't have, they can only handle so much information, so there's no more room for the pain. Or find the frequency of those nerves to just get them humming, and so that they're actually kind of the same thing, so that they're actually filled with sound, and it stops the pain from coming. But here's the big thing, and that is to fix the what is causing the pain, right? So fix the nerves, fix the muscles with frequencies, fix the actual part that's causing the pain in the first place, instead of just trying to stop the phone call, right? The transmission up to the brain, right? So just fix it in the first place. And that's a really big deal, right? But that's where it gets really complex. So let me show you the different types of pain that Evelyn did a little paper on. It was really cool. Thank you so much for your work on this, Evelyn. Okay. So there's neuropathic pain, and it's pain caused by damage to the nerves themselves, right? And that's what we're just talking about, to get to the pain, the problem that's actually causing the pain in the first place. So that's one type, and that's really tricky, they say, because it's hard to pin down what nerves are the problem. But if you run frequencies and combinations of frequencies and music, especially, I think, so you're running music through that nerve system, right, through that flow, through that actual system, that could be really effective, right? Then there's what John was just talking about, nociceptive pain, and that's the actual receptors that are picking it up and sending it. And those, you don't really fix those, you just inhibit those. Although it says here, they can start doing their own thing. So they can start sending pain messages long after the original pain is healed. So we actually can fix them. You know, they're doing their job, and then the pain goes away. It gets resolved, and these guys are still screaming, right? Right. So there's we could use frequencies to fix that. There's somatic pain, which is they come from injuries to the outer body, skin, muscles, ligaments, tendons, bones. Bone is somatic pain. They can ache. Muscle pain is somatic. Chronic muscle pain is more than a strained muscle. Your muscles may have, so these are like more, I guess, chronic issues, right? There's visceral pain, which are the internal organs, but they say that it's really hard to tell which organ it is. Sometimes there's referred pain. It's like you have kidney pain, but your back hurts. So it's hard to pin those down, but we can still address it with frequencies, right? And then there's basic body pain, where you strain a muscle, hurt a muscle, picking something up, or you have aches throughout your body when you have an infection, right? or have a cold or whatever, right? And then there's the pain, which is like fibromyalgia is probably one of the trickiest ones, because we don't even really know what's going on. It's almost like, it's like the adrenals and the kidneys and the liver have just given up, right? They're all, the adrenals go first, the kidneys try and help out, and then they can only do so much, and then the liver tries to help out, and then it just doesn't work. So pain just starts going through the body. And I have a friend that's got, it's like every week she says, Dave, I've got this horrible pain in a different part of my body, right? And it's like, that's more, seems like about the overall system of bringing them to peace, right? Although there might be frequencies, because I know that the sound table has gotten rid of fibromyalgia with 5 students that have used it over time. So, but there could be a whole frequency, combination of frequency and musical flow system once we figure out what's going on there. But I don't think many people know what's going on with fibromyalgia, right? So those are the main types of causes of the pain, which I feel is a bigger and more important job than just stopping the sensors. Although if you've got pain, stopping the actual nociceptive receptors and the actual nerves that are sending it so that you're not feeling the pain make me happy. When I was in just last year, when I had kidney stones, boy, anything would have made me happy instead of the drugs I was taking, which then screw up your system for a month afterwards. Okay. So that's kind of the overview. So before we get into specific treatment or specific things, let's just address this overview. Anybody have any comments on this overview that you might add to maybe fill in some of the components of how pain works in the body? Then we'll start looking at what you guys are doing for pain. So let's not get specific quite yet. Just any thoughts on how pain works in the body, especially any doctors or anybody that's been dealing with it and researched it in detail. Oh, maybe there, Rux. Can't hear you, Rux. Okay, you don't need to raise your hand, just unmute and start talking. I'm not hearing anybody though. Are you guys there? Are you there, Michelle?
Yeah, I
okay.
am.
Did you
When
have something to contribute?
Yeah, when I've worked with people who have pain, it seems that in the etheric field, what I sense, I can almost see visually is it's a certain kind of a static that extends beyond the limits of the body, the physical body. And if I can train, or I'm not sure if it's in train, I'm not sure what I'm actually doing, other than I know that my energetics are reshaping so that it's like the static you see from a magnet, if you play with those magnets, and the magnets, those little the little black filings are sticking up, and you can move them so that they go smooth. Once I do that, it seems that the pain, it's unblocked the energy flow. So now the flow, moves along. So I don't know what that has to do with nociceptors or any of this, but I know that it relieves pain.
Yeah, I think that's the most basic concept that I've always gone on, is it's a static or staticky, a chaotic vibration. It's like, and all of the vowels, all of the tones we make, and all of the crystal bowls and tuning forks are stable. And you can use any of those to overcome the static and get it back to stable. And so that's the most basic way I see it. But as far as the way the overall system works, is there any thoughts as to how the overall system before we get into actual treatments?
I don't know if you can see me. It's Barb. I think that, what I found over the years is that it's a matter of calming the system down, and a lot like you say about interrupting the cycle. So if we can interrupt that cycle enough with these calming, beautiful music or instruments or the vibroacoustic bed, and then their body, or they remember, which you have pointed out many times, your body learns to kind of do that and eventually entrains to overtake those pain symptoms with that constant use of it. So usually I'll do like a series of treatments, I don't like, it'll help them but you have to do a series of consistent treatments and then eventually wean them down.
Yeah, let's get into the details of that in a bit. I still want to say, does anybody have any comments about the way the whole system works medically before we actually look at treatments? Because I do want to get into treatments. That's really a more important part here.
Yes.
Okay. Leslie?
I just wanted Yes, I just wanted to comment on why one person would have a high pain tolerance and another person be super sensitive, and what would be the difference between that?
Well, yeah, I think that's, so John talked about that. I mean, he talked about Christ energy. I think, you know, it's like they say there are monks that live in caves that are in a lot of pain, but they don't feel the pain. It's so there's no suffering because they're meditating on something stable and consistent. And I think that's when you meditate on something stable and consistent, like especially things like love and light and source energy, then that can totally overcome it. But most people don't have that capacity, especially when the pain is really bad, right? I mean, so yeah, so that's one area, but I think that's a tricky area for some people.
Yes, and it still doesn't resolve the issue. So it's not
Right, exactly.
fixing it. It's only managing the pain. So you really, I love the idea of finding the cause and addressing that as the solution to the pain.
Cool. Okay, anybody else have anything on the overall system here?
Hey, David, I just wanted to say, when we talk about the gate
Looks
theory,
like you got your thumb over your video.
yeah, because I'm not like,
You're not presentable.
I'm sorry. No, I'm not presentable. So you got me in Hawaii at 7 a.m. Sorry, I'm not.
You can turn off your
anyway,
video.
thank you. Anyway, I'm just gonna say this. When you think of the gate theory, you also need to think of the body of how it regulates itself. It regulates itself to homeostasis a lot by its immune system. And so what are we dealing with when we needle a pain receptor, or we when we go to a pain receptor, and what it's going to do is it's going to send a response to the brain, and the brain is, what is the brain going to do? It's going to send white blood cells, it's going to send macrophages, it's going to take the army and it's going to send it in surplus, it's going to up the dopamine. So we have to look at, like, how is this affecting the immune system, because that's how the brain operates. Problem, we need all of our power to fight whatever this thing is, even if it's pain. And then you also have to think in terms of, well, if we're dealing with the nervous system, of brainwave states. Now, one thing that I work on my level, is I understand frequency in terms of notes per meridian, but that's all I know. The frequency levels that you are aware of in terms of specific numbers or frequencies, that I have no knowledge of. But I know the two things that I have been trained to go for is, how are we balancing the nervous system, because that alleviates pain. And I know we're not talking about specifics right now, but I'm going to give a specific example. I had a client. The client was a big sportsman, professional skier. He lives on his adrenals. You know, he's high impact. He's like, whoa, 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 go, let's go, let's go, let's go. He had a student come and nail him at 30 miles an hour in his back. The repercussions that he had of that, he didn't really feel any pain. He has such a dynamic, positive attitude. He's like, it's no big deal, it's okay. And that's his mind and his heart. But the way that it triggered in his body is he was getting like little tics. His foot was spasming, his back was spasming, his hips were spasming. And so I took a C note, which I like go for the base energy, for the root energy, and I went all the way down the spine, as well as doing acupuncture, but I went through the tuning fork down the back. It helped him tremendously eliminate the nervous tics that he was getting. So I think it's important to address, when we're addressing the frequency of what it's going to do, nervous system and immune system, if that helps.
Cool. You know, I mean, there's Acutonics that has their tuning forks in hospitals, and it's like, it can be profoundly effective. I've used tuning forks on pain. For me, I had my friend got a burn in, we were in Mount Shasta on a fireplace, and she immediately put a tuning fork on it. And then 2 hours later, she got another burn on another finger. Geez. And she didn't put a tuning fork on it. The next day, the one with the actual tuning fork on it was healed, and the other one had a big blister on it. And so this is huge. But here's the deal. If we're going to use tuning forks, I believe that the reason it's worked is because of what we were just talking about. It's stable, consistent vibration overcoming a chaotic vibration. There is very little research as to what frequencies will actually fix or help with different pains, right? And whether and ultimately what frequencies would actually help resolve the nerves. Now, we've got the whole set of frequencies from Peter Guy Manners, who did research and actually got information from a doctor that was in Germany in the war. And then they did research after that. And we've made CDs, and there's a full range of CDs that are really effective for nerves, tendons, ligaments. Let me just show you, because this is really, I'm not trying to sell this, but let me just show you because it's so effective. And it can, so we've got them for endocrine glands, and for bones. I mean, there's frequencies for everything you can imagine, right? And this is what they sound like. Well, there's arthritis. They sound kind of like this. And you don't listen to them. You put them physically on the body with headphones. Or we've got this device called the bass pod and the bass belt, which you can put right on the body. And it's got, they're like little subwoofers, and you can strap it on the body with these frequencies. And it's profound. I had a guy that came in last week with a very, or about 3 months ago, actually, with he had been in a car accident. And he said he had whiplash, and the pain for 2 years was on a scale of 7 to 9. For 2 years, nonstop, 7 to 9. And he used the bass belt and bass pod on his neck, and within 15 minutes, it was down to 2 for the first time in 2 years, right? But even this, I think, can be refined dramatically, right? But what's cool about this, these are the resonant frequencies of cells of the organs, of the vertebrae and all the different, I mean, these are the resonant frequencies of the nerves when they were healthy, right? So it's not only stopping the pain, it actually will overcome it and get rid of it completely. And that's very cool. But
David, the one thing I wanted to say that I'm thinking about a lot while I'm listening to all of this is that after my research, I really understood that the nervous system is rhythmic. It is a rhythm. And when you're talking about introducing notes like a C or the frequencies that you have, you're talking about introducing, or consistent, you're talking about introducing a healthy rhythm. Right. And so that's sort of what's in the back of my mind as I'm listening to you. We may be able to identify what the healthy or fixing rhythms are before we know the mechanism as to why that works. It seems to me like a lot of people are able to find a rhythm and use it and create an effect.
Yeah, it's very cool. I mean, if we also, once we find a rhythm or a frequency, we can octavize it up or down and get the opposite. So we can take a rhythm, once we figure that out, and then double it, and it'll be the same note. And I imagine that frequency will be helpful in to working with that actual rhythm. Or you can take a frequency that seems to work and octavize it down. That's my guess. I don't know that for sure, though.
On that note, maybe I can just say it. When I was working at HeartMath, Roland used to write about how the frequency of coherence actually inhibits certain pain pathways flowing to the brain. Like there's actual physiological mechanism, and I can find maybe the references that we use to cite that point. So this frequency of 0.1 hertz that you get into through heart coherence generates some type of neurological signal that inhibits pain reception.
Mhm.
And heart math techniques were also used really effectively in burn clinics and with other kinds of pain. But I remember some case studies from burn clinic, that's pretty intense pain. And a lot of people just, a lot of case studies of people using the coherence techniques themselves just to reduce all kinds of pain. So that's
Okay.
one thing to look at.
Very good. So let's go ahead and open it up now. So I know some of you have had pain and you've used different things on pain. Tell us about what has worked for you guys, if you have had any experience.
Can I speak?
Mm-hmm. Yeah.
Because sound healing has literally saved my life. So I have had fibromyalgia for years and years and years, and I was totally disabled. I was on all kinds of opiate pain medications. I actually moved to Florida to see if it would help. I was here a year. I was in nursing, doing nursing, and I couldn't work. And I saw Dr. Mitchell Gaynor on TV talking about sound therapy. And so then I researched and I found your...
Oh, you just disappeared. I'm not hearing you now. You guys hear?
No.
No. You just disappeared, Barbara.
We can't hear you, Barbara.
Barbara, did you mute?
I'm sorry, what?
We lost you for a minute there.
Am I on again?
Yes.
Yes.
Okay, sorry. I don't know how many, years, it was so many years I was on these meds, and, I really didn't have a life and I couldn't function. And so during the class, I had ordered the vibroacoustic bed from you and I started treatments. Within 3 weeks of being on that bed, I was weaning off all of the medications, all the opiates I'd been on for years and years. 3 months, I was off of everything. And that's when I said, okay, I have to, tell people about this and open sound healing. And I used the CDs, the Peter Guy Manor CDs that you had. And then I would listen to them. And then I would listen to a piece of music that would take me into that delta brainwave state. And in addition, I also use calm sleep to help my sleep, because fibromyalgia, you don't get go into that state. So then when I opened, so my specialty was pain management, what I did was I also not only use the vibroacoustic bed. So if someone comes into me with pain, I have the pods and the vibroacoustic bed. And I'll find out, what the main system of their pain is, whether it's, bones or muscles or whatever, fibromyalgia. So, and then I'll use the Peter Guy Manners frequencies, but they don't have to listen to those. So then I use all the sound healing instruments, the bowls, the monochord, the, gong, whatever I have. I'll just do a whole concert, so they don't have to listen to those frequencies, but they are going through their body. And I'll use pads too if it's a specific part I can't get to, like your hands or something. And then I will end that when the frequencies end. And they will, again, listen to, depending on what we're working at. If it's for pain, then we want to take them to that delta and subdelta. So I will use a piece of your music, your beautiful music, that takes them into that state. And by the end, they are in an amazing state. And what I do with them is, usually their pain is decreased substantially. Like if they come with an 8, and they're down to a 2 or less by the time they leave. But because many of these things like fibromyalgia, it's a cumulative thing, I book them for a series of sessions. And I tell them that at the beginning, because that's what I'm trying to entrain their frequencies and calm their system down. So what happens is, if they're say you had to have 12 sessions. So I know they're not going to come every day. So I usually do them like 3 times a week for 2 weeks, and then we evaluate. If it's calmed down, then I'll do 2 times a week for 2 weeks, see how they are then. And then we'll go to 1 time a week. And usually by the time we get to 1 time a week, they are so much more improved. And then at home, I
lost you again. Come back, come back, come back.
Lost you, Barbara.
Got you back now. Lost you for about 15 seconds. Oh, no, not bad.
and the whole experience is just like a journey for them anyway. So they're so calmed down, and their system is being entrained. And what's happening too is that their body's remembering it. So with me now, with my fibro, like I can go for weeks now without even using the bed, because my system has just calmed down so much. Then I notice, okay, all right, I'm hurting again or whatever, and I'll get on that bed, I'll put the frequencies in through me, and then that like tunes me right up. It's absolutely amazing. And I've had so many people have helped with pain doing it this way.
Excellent. Very cool. And the people you have with pain are not just fibromyalgia, they're all different types of pain, right?
I had an 86-year-old man who his spine was literally disintegrating, fracture after fracture. And, I did this with him, and he got down to like an aspirin a day. I mean, he was so cute because he was telling everyone, because sometimes I would do some chakra things and bowls, and I didn't know how he was going to react to it. And on the 4th treatment, he opened his eyes after unconditional divine peace. And he said, I was afraid to open my eyes. I didn't know if I was alive or dead. I was floating with the angels. And I always use him as an example. A lot of people will say, we'll call the bed sound healing on steroids, or your body becomes the instrument. One woman who actually does sound therapy and uses crystal bowls and everything had never experienced the bed. And she said, I saw colors, I saw my dead mother, and at one point I thought I was dead, but I didn't care. So it does amazing things, that whole experience. And the one more thing that I use too, because talking about the origin of the pain, I have developed with a hypnotist who does like quantum hypnosis, and we have combined sound healing and hypnosis. And what happens is that we take them down through some introduction to different sounds at the beginning, and then I stop. I don't play the bowls yet. And she hypnotizes them, and she helps them to maybe see, like, especially if it's some sort of emotional pain or something else causing their pain, what the root cause might be through using your subconscious mind to determine the root cause. So she helps you visualize that and helps you clear that. And then the second part will be, because by then she leaves you in a happy place. You're not in your normal waking state yet. You're still down in that sort of theta state. And by that time, you're just happy, and you will listen to anything, and you will just lie there because you are in total bliss. So then I'll play all the bowls and everything, and they just absorb that. They are beyond bliss. And then she'll return you to your normal waking state. And we have found that it is like incredibly powerful. So using that for pain is amazing too.
I love it. Cool.
Hi.
Yeah?
I'm sorry I didn't jump in soon enough. My question is in regards to physiology, and I don't know whether it's significant, but from the little bit of training that I had through the Network of Light program from the Monroe Institute, it seems that that it might affect your research as to whether or not you're working on a current injury or something that's chronic. It seems like there's an evolution of the nervous system response, and I'm just wondering if that should be on your list. if
Yeah,
maybe
no, I think
of
that's
that.
excellent. I think that's really critical. Yeah, it's a big difference whether, because, you know, this is one thing that I've learned is if you have a current bruise or something that just happens, if you get frequency and vibration on it immediately, the body doesn't have a chance to go, and freak out and then start going into that whole you know, spiral. And it's incredible. I learned this from a chiropractor. It's like you can even, if you like bump your arm, if you just rub it really quickly, you get a different frequency into it, and it doesn't go through the whole pain response. So that's really cool. A tuning fork on something immediately after you get hurt is really cool. But it's really, as you say, I think it's critical. It's quite different when it's been there for months and months. Excellent. Anybody else? Oh, I've got something I want to share. This is from Olaf Skile. Go ahead and mute if you don't have a noise, and then we can continue with people sharing here. Olaf Skile did like years of research on thousands of people, and here are the frequencies that he came up with for the sound table, actually, but these could be extrapolated, of course. So he said 52 hertz reduces most back pains, menstrual pains, climactic problems, aids in softening scar tissue. 50 hertz for asthma, bronchitis, see if there's any other pain in here. Spasms, 40 hertz. Abdominal massage, sports injuries, 40 hertz. Spasm issues, pain between the shoulder blades, 60 hertz. Frozen shoulder, 68 hertz. Right? I mean, you can just go on YouTube and do a search. I'm not YouTube. Go on the web and just do a search for online frequency or tone generator, online signal generator, and just put in these frequencies and use them. But it would be really, it's really good because, you know, still, I mean, if this is really true, how come we haven't like completely cured pain? How come that we're not using, everybody's not using this? I mean, if it were really 100%, and so again, it makes me think, is it, how long do you want this frequency? Is it a frequency? Because when you have a stable frequency, the body doesn't react to it as well. Maybe it needs to go up and down in volume. Maybe it needs to move back and forth a little bit with panning. Maybe you need a combination of frequencies. Maybe you need the harmonics of these fundamental frequencies in there. So this would be a really good place to start, right? To play with these and work on specific issues, it seems like, to take it to a whole nother level, right? Because he was using sound tables, I think, instead of putting frequencies right on the body. Turning fork right on it. Yeah. But here's another thing that I want to throw into the mix. You know, there is something that I've heard is really effective for pain, and that's microcurrents, right? I mean, the people that do microcurrents and electromagnetism, they say it's like incredibly effective. And so I don't know the frequencies of they're using, but they're published. Right? So we could look at the frequency of microcurrents electromagnetically and extrapolate those or octavize them down or do a formula to get them into sound frequencies and try them, right? Okay, I'm gonna open up. Who would like to speak?
David, the acupuncture and acupressure have been used for very effective pain relief during surgeries even. So it's not like it hasn't been done. This traditional Chinese medicine has been doing it forever, but not.
Yeah. It's interesting. I've gone in for pain where with acupuncture, and sometimes it's like completely fixes it. I've gone into for other pains and it's done hardly anything. So
I would have to agree with that experience.
Uh-huh.
And I feel like there's some other, I have a chronic condition, I have fibromyalgia. And so I have like typical pain patterns. And if I use acupuncture, most of the time it'll work on those pain patterns, but there's days that it doesn't, like you just said. And I'm not understanding, and I try to track what did I change in my environment or emotionally that made it not work today. The same with these little lasers that they're selling now. They give you frequency choices, and so you get to know typically what frequency works on a type of pain or injury. And sometimes it's astounding, the change. Other times I'm going, it's not working. Am I putting it on the wrong place in the body? Is this a referred pain today? But overall, I would have to say it makes me think that there's an interplay of things going on that affect the benefit of the treatment, but I haven't been able to track it.
Right. Cool. Yeah, I mean,
Could
to
I
figure.
mention,
Go ahead. Go ahead.
The difference
could I
between
mention
Eastern and Western.
hydration? Oh,
I'm sorry, who's this?
Well, I want to say this one thing about traditional Chinese medicine is that it treats an overall condition within the body. So as the condition is changing, things are going to shift. And when in Western medicine, we look at cause and effect, we look at specific solutions for one issue, whereas as things change, it's probably why if your overall condition is changed, it wouldn't be effective one day and it would be another.
Well, one thing I think about when you're talking about this also is, first of all, refining it as to why is it working one day and not another, to figure out precisely and get down to the specific. But secondly, what if we did sound, microcurrents, acupuncture, and lasers all in one treatment, right? I think there's a good chance that pain won't have a chance, right? I mean, like I
Or
always
would
say,
it disrupt the electrical of what's happening? Would it disrupt, and then you get the benefit of no particular treatment?
okay, anybody else have some
So,
other?
yes, please.
I have a
Yes.
idea.
Who's this?
Carmi?
Carmi, okay.
Yeah, so I'm new to the whole sound healing. So I haven't been able to try all the gadgets, but something that's been very effective for me, I have the fibromyalgia and cervical spinal problems where I've had a couple of surgeries. But I find laughter is to be very, very effective with my pain. Whenever it's getting to me, I will start laughing, and 10-15 minutes of laughter will bring my pain level down and keep it down for a couple of hours. It's low tech and you can use it anywhere. You don't have to laugh loudly. You can do it quietly, or but it works.
Okay, so Carmi just did her final paper in the certificate program on laughter yoga, and it was just profoundly cool, and we were all cracking up. Okay, so of all the laughter ways you could do laughter, what's your favorite that you could show us right now?
Well, when I'm really hurting, just the big, it just seems to really disrupt the whole pain process, and just laughing all out, ho ho. And if I'm out somewhere and I can't laugh like that, just to to do the quiet laugh, but I'm inside, I'm doing a big laugh and nobody hears it. They're going through the.
Carmi,
cool.
Carmi, do you find that your guffaw for the lower belly and your tee-hee for the up, do you target them? Like if you have a cervical pain, do you go hee as opposed to a gut pain that would be guffaw?
No, I haven't specifically targeted like that. Like I said, when my pain is really severe, I find that the big guffaw is the main go-to. If my pain is milder, then the others are okay. But yeah, it's that big guffaw that really seems to break up that pain transmission and calms it down.
That like dance, like it just moves the endorphins, it switches it up, because I do the same thing, but I'll do it with dance. I'll put on music that I just can't stand still to, and I got to move, and the same thing will happen.
Yeah, I think dance is not just, I mean, the laughter is like partially physical, but the dance actually gets energy flowing through your body. And I think that's really, really cool. That's working. besides the
I
body.
just wanted to comment that when you're moving energy through the body, the level of hydration has a massive effect on the electrical currents.
Mm. So it's critical to drink water, more water. That's one of the treatments that in Evelyn's paper was drink more water. It's really critical. Anybody else have experiences with pain and how they with it?
David, it's Barb in Baltimore. Can you
Mhm.
hear me?
Yeah.
My face
Hey,
is not on
David,
because
it's
I'm
Leslie, and I'm gonna.
Hold on, Leslie. We got Barb talking.
Okay, no problem.
Hi, I just wanted to say, as a nurse, the first thing we always learn is pain is subjective. So to make it very simplistic, I've been with a lot of women having babies, and the pain is chaos.
You guys go ahead and mute until we're hearing a lot of background noise. Okay, I'm sorry. Go ahead, Barb. So what about it's subjective and so what? Oh, did I mute you? I might have muted you. I thought you were on the telephone. You might have to unmute again, Barb. I'm not sure which one you are. Are you there, Barb? No, lost you. I'm not hearing you. Okay, someone else want to share? I'll come back.
All right, David, I'm up. So
Was it-
I got kicked off for a second, so I'm back. It's Leslie. I
Okay.
was like, I'm gonna go backtrack a little bit. So I like microcurrent. I do. I like it. I like it. It actually stimulates the ADP, ATP kinetics of the synapse, so it like actually triggers the muscle. That's great, and I like it. But one thing that the devil's advocate to electric current that's high level is it's like a blaster, and so it's kind of perceived that it can like be like a cup of coffee where it'll like take it and make it pain free, but then like there's kind of a crash. And I also think in terms of eliminating pain, I like a level, consistent like pathway. And I know time and money is of an essence, but if highs and lows, like I feel like it's that's something to kind of consider with this of like, are we going to blast them, and what is the blast going to do, or what is better, several treatments or just one? And that's just something on my mind that I just wanted to share, so we don't want to lift them up with the current and then they crash when their system's trying to regulate. So that's why I always think of how are we regulating the immune system and the nervous system. What are your thoughts on that point of view?
It's really interesting, well, first of all, what you're saying is maybe we're going to need very specific number of times for whatever we do. But, until we get really specific as to what we're putting the frequencies and the music or sound on inside the body, we don't really know, right? Because you're working in overall systems and, working on the brain level even. But when you get really specific, it's then it gets really, then there's going to be very specific parameters as to, okay, well, we're not going to blast this specific nerve more than this many times. So I imagine it's going to have a very detailed protocol as you could, fry the little sucker, right? And so, yeah, that's what I think.
Thank you.
Okay, anybody else have any things they do? I'm going to mute everybody here except for Jackie. Do you want to talk, Jackie?
Yeah, can you hear me okay?
Yeah.
Okay. I was just going to point out that something really interesting to consider, and I think would probably be a fairly reasonable way to get specific with research, is the vagus nerve stimulation. Because there's already quite a bit of studies going on with it for fibromyalgia, Crohn's disease, chronic pain issues, depression, migraines, epilepsy. And they're actually, the FDA has already approved that you can actually put in this sort of a pacemaker, right over your chest and it sends little electrical impulses into your vagus nerve. And it's been successful, but there's so many, obvious risks associated with doing that. So just using, if you could even make one of your base pods and actually just have that, on both sides of the neck and just actually stimulate it with sound would be an interesting study to do for quite a different variety of issues,
So
migraine.
what are the dangers of vagus nerve?
So with the implant that they have right now that they've been using for kids with epilepsy and for people with depression and stuff is one that you could overstimulate it and send your nervous system off into, deep space. There's obviously infection. There's, the battery will eventually die. You'll have to have surgery again. There's problems with, coughing. It can affect your throat and your speech. And, it's just, it's a device that they implant. So,
Yeah, if they put in. So there's ways to, I know the eardrum, the vagus nerve is connected to the eardrum. You would think you would be able to actually just use the frequencies and access it that way.
Right. Or you could do both. But it's interesting because in the research that I've done, it's like they can stimulate different areas of the body with different frequencies to that. So like some that were used for migraines were between 5 and 10 hertz. And then some that were used for epilepsy worked between 25 and 30 hertz. So it's interesting because in the research, it doesn't seem like there's a specific frequency for the vagus nerve. It's like the different frequencies that go through the vagus nerve, address different areas of the body, which.
Okay.
So.
VAGUS for Vegas.
Oh.
It's like the Las Vegas nerve.
I wanted to return to the discussion of the format of any research.
Okay.
And I personally, when I was selecting my research, I would not have used research that didn't have a control group. And obviously double blind being the most seriously regarded by the scientific community. But at the very least a control group, because it's wonderful to say, and it's a beginning, and I do agree with you, it's a great start to, collect, and then again, we also have to talk about minimizing the variables. So it's wonderful to collect the 2 or 3 variables that you're working on and be able to show a consistent effect, but without a control group to show that this is an effect above the placebo effect. Scientifically speaking, that research would not be taken as seriously.
Any thoughts on that, Jennifer?
I do. I have a lot of thoughts on that.
Well, okay, Leslie, you said it, Jennifer.
I'm sorry, Jennifer. I didn't mean to interrupt. Let me let her go.
Okay. Do you have any thoughts on it? Because Jennifer, is you are you there, Jennifer? She's not there right now. Okay, go ahead, Leslie.
Okay, I agree that the scientific community is in love with control studies. I do feel like in real life, though, that is like taking a part from the whole, and you're never going to be able to get all of it. It's like compartmentalizing the human.
You're breaking up. Yeah, you can't hear you. You're breaking up.
Being into just a super level. And I personally cohort studies. I like experience as well as the control. And sometimes I feel like the control, like it gets so complicated. I'm not against it. I'm
Yeah, you're breaking up, Leslie. So let me continue because we can't hear you, Leslie.
not against it.
Leslie, we're breaking up.
But I don't think it tells the whole truth
Leslie, if you can hear me, I'm going to mute you because you're breaking up too much.
That takes away and just gives us just a little.
I don't see you unmuted anymore. Okay. Okay. So, this is my thought about it is down the line, I think we should do tons of research that is not controlled to get, as I was talking about in the beginning, to figure out what we really want to spend money on, which would take more money with the control group. I think it would be much better because when we're talking about exploratory research or action research, like I talked about in the beginning, I think it's much better just to get data on where we're headed so we can help figure things out. And then once we get down to it and we say, okay, we really know that these frequencies on this specific nerve will actually do it, or this combination of frequencies, and then we can do the actual research and prove it. And we go, oh my God, 99%, we have a control group, we put it out there, then it's really cool. But otherwise, I think it's a waste of money when we're actually trying to figure out, which is what this group is about, is trying to figure out the best way to research so we don't waste time and money. That's my thought about it.
That makes sense. It depends on what your goal is. If that's your goal, then that makes perfect sense. If when you're ready to publish, then you consider the other.
Oh, cool. Yes, it's helpful. Good. Good.
David, on your list of what people are doing for pain, I'll just put it out there. I didn't have the courage at first. Probably one of the most effective pain reliefs that I've gotten is straight energy work from, we have a person, a very talented, humble man in Winnipeg here, who his treatments and he teaches you how to do it on yourself, is to manipulate through intention energy into whatever tissue you're working on. And I had one time, I was able to validate the strength of that type of treatment. I had dental work and it caused a condition in the nerve that the whole side of the face would flare up with motion, with change of temperature, with whatever, extremely painful. I would alternate acupuncture treatments and going to the physiotherapist who had that device, that electrical device that he would like stick on you. But the man who was doing the energy work, his treatments were just as strong. The difference was I didn't generally find, he could bring it down a notch or two during the treatment. I never understood, I still don't, I still go for energy work for my pain. It would be like a day later that you would suddenly realize like it's gone. And I don't understand that, but it's happened to me. I've been using him for years for a number of different pain issues. And it happens over and over and over. So I don't know why there's a delay in response, and I don't know why it's so effective, but just straight hands-on energy work with intention, similar to Reiki, except I never found any Reiki practitioner who could make as much of a change as just his, which was pure intention, collecting the energy, focusing on it. And that's how I help myself a lot of times.
Cool.
I don't know if it's too woo-woo for your project, but I thought maybe it could go on the list.
Oh no, yeah. It's cool, but we'll post it. But this is not where we're headed. But it is great. I mean, I have this energy worker that I work with. I fell and it felt like I had a vertebrae poking my heart, and I went on the telephone with this guy, and within 1 minute of him working on me, the vertebrae popped, and all the pain was completely gone. After 2 weeks of being in excruciating pain. I mean, in 1 minute, right? It was incredible. So, yeah. Okay. So really, okay, who else has, so there's a few things I want to share that are really incredibly effective. Getting physical vibration on the body is very cool, right? It's very helpful. And so that means you can totally put a Tibetan bowl on that part of the body, right? And if you're just doing overall, you can put a really big Tibetan bowl on the chest or the stomach, but you can put a smaller Tibetan bowl and put your finger right in the middle of it to hold it, and then ring it or hit it you know, or just hit it while your finger is holding it on the arm or on the leg. And that, somebody, I'm going to mute Kitty here because she's got music going on. Okay, and so you can do a whole massage with the bowl up and down on the different parts, right? You can do the same with an actual a small crystal bowl. You can put it on different parts, especially on the chest. So, but and then of course tuning forks. They say with tuning forks, it's if the pain is too much, then you put it on both sides of the pain, and it will draw that energy away from the actual pain. If it's not that bad, I put it right on the pain. If you're eating, go ahead and hide your video there. Yeah. And then so if you're then you because I mean tuning forks right on the pain, if it's not too bad, it's been really effective. Again, I found that 108 hertz works really well for a lot of pains, and so I really like that. Anybody know of other frequencies of tuning forks that they've used that work really well? The Schumann resonance frequencies work well because it's a lot of physical vibration. It's a low frequency. And I found that low frequencies work really well for muscle pain, but it's not always the case. Yeah. Any other frequencies or instruments or any other stories of what they've done or had pain go away completely? You're breaking up really badly.
Tell you some things I've done.
I can't hear.
Let me see if I can fix that.
Okay.
Perhaps by taking off your video, it could help better with the sound.
That's good idea.
I'll try that. Can you hear better?
Yeah, much better, thanks.
Oh, really? Okay. Anyway, I'm a chronic pain sufferer. I've got arachnoiditis in my neck. I've been struggling with it for about 25 years. And after, I started working with lights at first and then sounds because I found them to be effective, and then started using different sorts of transducers and then placing them on my body in different places. And that really, especially the lower frequencies, help with pain quite a bit. I use a range of them that I run at the same time because I've got multiple transducers. So I try to hit the 3 brain centers. And when I do that with corresponding frequencies that would be appropriate for those areas, that the balance of that, like in one session with all of them.
Wisseling en onderzoek naar de effecten van geluid en klank.
Okay, I muted her. Tiana, please don't unmute.
The effect of all of them simultaneously really seems to help. And I haven't figured out which one because I'm doing so many at the same time. They're pre-recorded sounds. So I've got various tracks from people like Source Vibrations, your work, different things that are out there that I mix down into tracks, and I'm able to play those through the transducers at the different locations. And I found that to really be effective. I've created a few different what I call modes that are more generalized. And it really helps the comments from the people. It's helped them with pain, but mostly what I'm hearing is it's helping their mind a lot. They're feeling a lot better mentally. And one guy was, I was seeing, he was having a young man with some kidney issues. And he felt that after the treatment, mentally it helped him, and he was able to actually find a donor, and he felt like that led him on his course to get help, where I don't know if it actually helped him with his kidneys or not. But I found that was interesting. And one question, I haven't seen all your info. I haven't been able to download it all, but I just had one question. If you had any experience with the BioWell device, have you heard of that?
BioWell, no, I don't.
BioWell, yeah, a guy in Russia developed it. And it's a device that basically takes pictures of your fingertips. As a result of that, it's very sensitive, and it gives you a readout on your body that's based on sort of the Chinese medicine system.
Yeah.
And it's pretty fascinating. And I
There's a
only,
lot of systems like that. There's those. There's the nutra-energetic system, which we have. That you
okay,
put your hand on a pad. The QXCI, the Asira. There's a lot of them that can be very cool. And
yeah, I would like to, yeah, I'll see those because I did have a demonstration on it and then got a before and after on a few people and could see some benefits based on those readouts. But I thought something like that would be useful in determining the effects. Now, I don't know if anyone's been actually using one of those devices to test the frequencies and see a before and an after.
it's interesting when I'm thinking about it, because where I'm headed here with this, and then we can continue with more of this, is to figure out like 5, maybe 10 things in the body that are the actual cause of the pain, right? So not looking at fibromyalgia, more like these receptors and the nerves that are going to the brain. And then we look at the frequency of different nerves that cause pain, the frequency of different muscles. That would be a good amount right there. And maybe a few other things, maybe bone pain, right? And then we focus on the core issue that's causing the pain. And then we start with the research lab, we set up a research lab and we start trying different frequencies for those specific types of causes, right? And then we can really start pinning it down, because otherwise it's just like hit and miss, because there's always the aspect of getting people blissed out and in peace and still, that will help every time, it seems, right? This any way you can get people into a stable, consistent emotional state, not only to overcome the pain, but maybe that emotional state is causing the pain, right? Or it's a loop between the emotional state and the physical body. It's like people go into fear, and then that causes even more, that's common, right? So maybe it's a two-pronged approach where we get really specific as to the nerves or the cells within the nerves, or the cells within the muscles and their frequency. And we then look at what music or have a full range of music that we could put out, or even just have anybody submit to get people in the zone and blissed out, which we're pretty far along on that. And it could not just be my music, but any music people really love, right? And now we get them at peace, which can actually, because again, the emotional state can trigger the physical state. So sometimes we get rid of the pain, and then someone goes out and runs that same emotional state, and they're back in it.
Yeah, David, I agree. It's I didn't really speak before. It's Angela. I'm gonna put my video off. I just wanted to go back just to before, because you were saying, what are things that actually worked. I was intrigued by the seminar that you posted, and in there, I know he mentioned that playing your most favorite music can very much alleviate the pain, as it makes total sense. I've had my experience with my wisdom teeth and getting them removed. I had an peculiar incident where it started. I had ingrown teeth up until my 40s, and then removing them was very. They started growing at that point. Usually, you get them out when you're 18, and so forth. When it started coming out, I wasn't sure if I was having tumors in my brain. I had excruciating pain. I know during that period, I was trying almost anything. I'm a musician as well, so I was playing a lot of music and trying to just alleviate the pain that way, which did work. There was a certain amount that I can at least control the pain as it was, because it took about 2 years for me to really figure out what the pain was caused by. I wasn't really sure that it was my ingrown teeth that was coming down. So it was that bone pain, and that's very excruciating. And then when I actually did get them removed, the surgeon who was doing it Of course, you know, I was under midazolam, which is a drug that kind of just makes you go, you know, into a okay state. He asked me, you know, put your most favorite music on headsets. And as he was doing the procedure, you know, I had that on, and I really can say that that experience of having it removed that way was very therapeutic. Like he did it the right way. I know some surgeons, they won't incorporate music into it, but I find as an adjunct to that surgery, it was very effective. And it goes back to exactly the seminar where, you know, putting music that you love, it causes the emotional thing. And from there, that blocks, you know, the pain receptors. So you are definitely not, and afterwards as well, I was listening to music so that the inflammatory process is happening to me as I'm healing, because pain, a lot of it has to do with your inflammatory process. And of course, we went into that during the seminar too, of, you know, you have your macrophages, you have all your, you know, your immune system kicks in to heal. And that also causes pain. So as you're healing, there's a pain process that goes there. I was also trying to get frequencies in so that I'd be listening to those. So I did have, you know, it was, I can't compare, you know, if we had a control group that didn't have the music versus frequency, how long a process would it take for you to heal? But I can say that, you know, music does help to alleviate it and not cause it to go as much. Just like you were saying, you know, if you put a frequency to your burn, you know, and you put that tuning fork there, it seems to, you know, how do you say, not make the whole inflammatory process prolonged. It helps to bring it, you know, to a faster state of recovery.
Cool. Excellent.
Angela, did your pain go away when your teeth were removed?
Well, there's obviously a lot of pain when you're, you know, yes, my pain, yes, it was amazing. It went away. I mean, yeah. I mean, it was the wisdom teeth that was causing the entire process. And I was losing my memory too. I went through periods where I was like, I can't believe it. Like I'm in my 40s and I feel like I'm, you know, I couldn't remember numbers. I couldn't remember stuff because as the teeth were coming down, it was stimulating the area in my brain that deals with, you know, memory and so forth. So there was an inflammatory process within my brain that was going on because the teeth were, you know, as they were moving and pushing out. At that point, there definitely was certain physiological, not just pain. I had memory loss. I had some things, which now that it's out, I can say that I've regained my memory. I don't have those lapses. I don't have issues with remembering numbers and so forth that I was having up until the point of removal.
David,
Mhm.
No, I'm getting bored.
I'm sorry.
I don't know who that was.
I know these people. That's the trouble with all these things. They turn into chats and
Somebody's doesn't know that their microphone's off. I don't know who that's speaking, but it's Shannon. I was wondering if I could follow up on something I put in the chat earlier.
Sure.
Okay, so I don't think this has been mentioned, and for me, it just keeps come up as important, and it's related to the observer and the observed, and the intention of the observer and the intention of the receiver. And if we think about, for instance, the Doppler effect, where depending on where I am, if we imagine like a spiral of harmonics, so we're going from red all the way up to purple, and then purple then goes up to red, and we're going deeper and deeper in or further and further out. So you imagine the Doppler effect, where when something coming towards is perceived as red, something going away is blue. Okay, it's two different things. And that reminds me that my understanding is that depending on what hemisphere is dominant at a given point, so people are generally dominant with one hemisphere or the other in general, but then they have a default to one or the other under stress. So my understanding with applying or offering frequencies, if we think of a frequency equivalent, either a color or a note or whatever the frequency is. So in some cases, if I'm left brain dominant or right brain dominant under a certain situation, I need to approach it almost the way an allopathic or a homeopathic would approach it. So the antidote or the thing itself. And so that's something I haven't seen you mention here, but when we're talking about, we're going to zero in on this frequency and we're going to this and that, the intention of the person. So a lot of research over the years and all of these like very talented sound healers or even ancient studies, they get the same result with totally different scales or tones or whatever. So you have to wonder how much of that is the intention of the observer, in which case, and the other is the listening in advance of where, which is where somebody like a dowser or people who can, communicate within the different dimensions or some sort of way of measuring to know which hemisphere we're dominant in, right? Because literally blue and red are opposites, but Doppler effect depending on which way I'm looking at it, right? So to me, that's really important. And it's kind of like having to be a systems thinker the entire time before you zone in on one frequency or the other. Because you'll find if you do a lot of research that over the centuries, I'm almost done, but over the centuries and even currently, you'll get really good results from very different and almost sometimes opposite on the color wheel or the light color wheel, whatever. Right? Like it's kind of interesting. So I just wanted to mention that. So keep in mind the Doppler effect and keep in mind the default network of hemispheres and then the difference between allopathic and homeopathic. And I think that's kind of something to keep in mind.
There's a couple of things. One thing, I know exactly what the Doppler effect is, and it's actually not a perceptual thing. It's actually, it's just the number of waves that are hitting you based on things moving towards you, because frequencies go up when a car is coming to you and go down later. But here's it sounds like what you're saying is it has to be very specific frequencies for, or maybe it's different from one person to another, right? Maybe that nerve is different. And that is the Raman spectroscopy or spectroscopy that John Stuart Reid is using could actually, I don't know how to spell it anymore. Okay, could actually help us find those actual frequencies of that cell that is causing the pain. So we could ultimately have to have a very specific device, which could be something like MRI or this Raman device, or even the different devices, the BioWell or the nutrienergetic system. So we might, you're right, we might need a very specific system to monitor it, to assess it for that specific person. Okay? But the other part that you mentioned is whether you're working on what's wrong or what's right. And that's important as well. There's two ways to go. We could actually go in and actually find the frequency of the nerve that is broken, or whatever it is. That nerve is like scrunched, or whatever nerves do, where there's a break in the synapse, I guess, but there's something wrong with that nerve. We could go in and try and use frequencies to break up what's causing the blockage, although I don't see that as being very effective. Like if you got a cancer cell in the way, that would be effective. But you normally wouldn't want to break up the parts of the cell. Maybe, but so we're mostly focusing on what's right, where we're looking for the frequency of what's right for that cell. Now, when we look at the frequency of what's right, you can not only look at the frequency of what's right to resonate it back into its harmonic working state, but also maybe it's a combination of frequencies. But here's the other area that I think in all of this might be really critical, even more important than frequency, and that is musical flow. Nerves are in a system of flowing electricity and flowing sound, right? And if you simply run a melody through that system at the right rate, at the right rhythm, that could totally, like a river, could totally break through the blockage and smooth it over. So I'm thinking that there's a good chance that musical flows through a nervous system could be actually, no, we're not talking about listening to the music. We're talking about running that music through a nerve system. Could actually be way more effective than just a frequency. So that's what I'm thinking.
David,
Right.
it's Elizabeth. I want to just say that I thought you were touching on the central issue there. And it's making a lot of sense to me, because the one thing that we cannot heal yet is damaged nerves. Nobody has done it. It's not proven. It's not anywhere. I have damaged, or my hearing is damaged. So I track that
okay.
research.
So that's the challenge. That's what when I hear something like that, I go, okay, that's our next thing we can fix.
Yeah.
Well,
yeah.
Go ahead, Elizabeth. Go ahead.
Exactly. And what better nerves to fix than our hearing nerves, huh? So
right. I know that
but-
one too.
right. But so I really liked that you made the distinction there between healing nerve damage, which nobody has done yet, and healing blockages in the system, which is what I believe sound healing is doing all the time. And that's what we could identify right now. Reed gave us those frequencies. I'm wondering if there's the research behind how they got to those frequencies. Did he provide that to you?
That's what we really want to know. He said he had references, but references can mean like, oh, we found it with psychic. I mean, yeah, we want to know. That's really where we should go, is look at those frequencies that he said are really effective and say, how did you do the research? That's what, if we're going to do informed research, let's work on the information that's already there. Very good. Thank you.
Yeah. So 2 points. I thought you made both of them really well.
David, one aspect that I'm concerned about, and maybe it's part of the research, is knowing whether to treat a localized area or full body treatment. For example, I have pain in the low back, I tape on a magnet, it makes no difference this week. So then I sleep on a magnetic bed that has a whole bunch of magnets, and the next morning, pain is almost gone, down to a 1. I hear the lady that spoke this afternoon about having a sound bed as opposed to applying to one particular location. I guess it's different if it's a recent injury that we can see. You break a bone, so you could do some treatment in that area. But I'm feeling like there's an interaction between the nervous system on a level that we don't always understand, and that it might make a difference to healing.
Yeah, I think
cover
there's a
all
simple
bases and do the whole body.
I think there's a simple answer to that, and it's exactly what she was doing. Do them all. Do all.
You're
I mean,
right,
she was right. She was doing the sound lounge, which is the whole body, but she was using the base belt or pod right on parts of the body. So do them all. Right. But the more ways you lead a horse to water, the more chances it will drink.
That's my thought. Like the more frequencies we're putting into the body, and the more ways that we're bound to like cover something,
I like what Kat said in the chat. Start with relaxing the whole body, then go specific. That's really
I think that might be important in the design of whatever research you take on, is to consider localized or full body or both.
Well, if I could add, David, that was why I mentioned something like the BioWell device or something similar. I'm running, I don't even know how many frequencies. It's hundreds, and it's working. But I'm thinking, is that too many? Should I start backing some of them out and seeing what the results are with some type of measurable device? I'm running, I couldn't even count the number of frequencies. It doesn't seem to be doing harm. My hope is the right one's going to be there when it's needed, and the body's going to do what it does with it. And if you supply it, it's there. It's like almost a raw material. It's accessible. But I'm wondering if I'm running too many, and I should be narrowing them down by testing.
It's amazing how little we know. I mean, there's it's kind of crazy. It's really crazy. I mean, the potential here is so huge. I mean, we've heard and seen miracles. I mean, I hear of people getting rid of pain all the time. I had someone 5 years ago. They came in with sciatica, and they were going to have surgery the next day on the sciatica. they got on the sound table with the pillow on top of them and got off and she was just bawling. She said the sciatica is gone, right? And there's stories like this all the time with just like 5 million, which is nothing, right? There should be, I bet there's someone right now that will easily put up 100 million. And we've got some that would do it as well. And we could create a research center, and within a year, we could have miracles. I mean, if you were to open up a treatment center and just do what Barbara is doing right now, I mean, that's huge. I mean, the effects are already so effective. And within a year, we could dramatically help people.
David, may I speak?
Yes.
Yes. I just wanted to mention how the heavy metals that are lodged in the brain and other parts can misdirect and redirect and block electrical currents and synapses. And I'm interested in how sound can actually disperse those elements, because they're all elements. They're just elements of the periodic table.
That's interesting.
And I think sound can have an effect on that. That's where my interest lies.
That's very cool. We could, Evelyn, you're sending messages to me instead of everybody. So yeah, I mean, a few things come to mind. We could find the frequency of the heavy metals and help disperse them, and actually use like ultrasound to break them up. Or the other is to, run, I'm just winging it here, run, frequencies through the lymph system to activate it to help move it out, or whatever, find what would help detox the metals. I mean, there's the people that are doing, what's it called, where you get rid of the heavy metals?
Well,
Chelation.
Chelation, yeah. We figure out, okay, what are they doing with chelation, and what might we translate the actual frequencies to be able to help that? I think it's very cool, because I think you're right. I think heavy metals are a big problem.
Frequencies penetrate. I mean, they go through, so I mean, that's my, the frequencies penetrate. They go through wall, they go through everything. So I don't even know how close it actually has to be to be getting through it.
Yes, but to me, in much the same way as we can actually use the mineral tuning forks to generate minerals, then why can't we actually disperse them? I don't think we actually make them not be. I mean, I think that everything, once it's come into form, is in form in some way. Nature makes it that way. Nature brings everything into form. But I believe that we can either move them, into the universe, as it were, or disperse them somehow to clear those blockages without like doing the things like chelation and things like that. I'm talking about using sound. That's where my interest lies.
David, along with heavy metals, you may as well put pesticides and viral issues.
Well, that's where, like, I'm actually a permaculture student, and I do it in the environment, and so I'm working on that. But I believe that it comes to healing the body as well. But I'm doing it as in to bring nutrition back into the foods, that the earth, it's all about the soil, and the soil is so depleted and so toxic in places. And I believe that sound can actually play a big role in helping the environment, because sometimes people don't realize how toxic the environment they live in is, and how it builds up. It is something that, there are so many things that add to it, but I think that sound is brilliant. Thank you.
Yeah, thank you for that.
Yeah. Okay. Anybody else have any experience with pain you want to share? You're using sound on pain? Yeah, that's interesting to work at the atomic level at Cat Sand, because, if that's even, I mean, we really don't know, at least I don't have a clue how to even think about at the atomic level. I mean, you can work at the atomic level, the cellular level, the organ level, the material in the organ level. If we're all talking about physical here, right? Yeah.
Well, just to say something more, if you think about nature and how things are created, it's always been seen as Pan is the messenger of nature, as it were, with his pipes, the Pan pipes, which is sound. So is sound part of the creation of everything, which is also then can move things?
Yeah, it's all
I
about
just
flow
think it's all
systems and sorry. It's all about flow systems in nature as well. The good news is there's people doing dramatically cool work in helping to clean up nature right now, including my next door neighbors. They just submitted a $5 billion proposal for not only cleaning up the environment, but also planting trees and they're to a union in Africa now that's helping. And so there's a lot of cool, but I think you're right. To find not only the frequency that will grow plants, the combination of frequencies, there's frequencies that will create more nutrients in the plants. There's all types of things, the way sound could be, or vibration could be used. There's also a company that exists right now that's found different colors and different frequencies of flashing colors that create different nutrients in the plants as well. The potential is so huge for cleaning things up. And or finding the frequency of the toxins in the air, exactly like the metals in the body, right? We find the frequency of the toxins in the ocean, and then turn the volume up and explode them or disperse them and break them up so they're not, or use this. There's a way to use the sound to actually collect them and have them go into a little area so you can collect them. So there's a lot of
and
potential.
to clean water.
Yeah, so just saying water too. Ocean. Yeah.
Yeah.
There's one of our instructors has a frequency that in clinical research repeatedly will clean the water in detail, especially with algae.
And also just a question, but with your guide's message, I think it's very important what you said about the links between heart, brain, and breath and finding the intervals. And with doing that, I've gone off track, sorry.
Yeah, well, if you actually use that and then find the musical flows within each of the 11 systems, that might just do it right there. That's more like the system level, right? So you now find the melody going through your nervous system of you, when you're healthy. Go ahead.
Do you think that is related to a person's divine blueprint?
Yeah, I think that's exactly. Yeah, this is what's really interesting, and maybe I mentioned it before.
And that's what we're looking for. Yes.
Yeah. In the divine blueprint, I think there's like an overall one that's the same, but then there's the one of you. And it's interesting. This is my what's the word? Thesis. This is my proposition. And that is that when we get down to it, and we have a device that can find the frequency of every one of the 70 trillion cells, and we use AI to map it all out, I bet we're going to find very specific musical interval relationships between different parts of the body, from cellular to atomic to cellular to materials to organs to systems. We're going to find it's and brain, right? There's going to be a very specific harmonic, and that's the key. It's not going to be random.
Pattern.
It's going to be harmonic, because harmony is what the body needs to actually be healthy, right? And there'll be flows through it. And we'll be able to map that out. And that is what I see is the divine blueprint. And we can then tune it to the person, but it will be very similar. The musical intervals might even be the same for most people or different cultures, right?
A pattern that fits everyone.
Right. A human pattern.
The same
might even help your kitty cat too.
David, there is a device that
reads the person's energy and amplifies it and sends it back to them, but it's not, it doesn't send like individual parts, just like whatever it is, and sends it back. And also just Han, I just wanted to say something about the different approaches and the gateway theory and kind of seeking a foundational principle. I think that proprioception, like being present, very present in the body, is the same concept as overwhelming the receptors with other stimuli, because embodiment and proprioception is the epitome of overwhelming the body with senses. And I've seen that like embodiment and the stronger sense of proprioception that results from it also decreases pain or increases the ability for the body to deal with it. And that it's related to people's varying baseline ability to tolerate it more than others. And one of the ways to increase that embodiment and proprioception might be to treat the person with their home note or natural resonant frequency. I don't know if that's been tried yet, but I think we have to treat more specifically and particularly for acute pain. But I think that ultimately we're moving towards the body's ability to regulate itself, which happens when the spirit is fully embodied in the body, which can be facilitated by increasing the person's inherent frequency. And everything else we do kind of helps the body regulate back to itself and help things flow. So
Yeah, I think in a general sense, that's really where we're headed, is to get the brain, heart, and breath synchronized. I mean, when you get that, all your system, your immune system works better, all organs go into alignment, you're more creative, and it's a portal to higher dimensions where you're one with the universe, and then miracles happen. I mean, it's really kind of a critical part. Otherwise, all of this stuff is just going to keep regenerating. But it's so funny, when I created this, it's to get it into hospitals, and hospitals don't think of that. They do. Doctors are thinking of it, and they are doing referrals. You need to go see this person. But I think that's another cool thing is I just had someone, is it Carmi? Was it Carmi that's actually going to start working with a doctor? Or was it someone else?
Yeah, I am.
Yeah. So what's happening is doctors are really getting turned on to this. And so Carmi's got an opportunity where this doctor wants to refer patients to her for pain management, right? So, and again, with what we know right now, we've really got some pretty cool things that are at least have no side effects, are really effective and have no side effects. I mean, incredibly effective sometimes.
I know of someone, he's based out of Italy. His name is Emiliano Tasso, and I've met him here in Montreal on some conferences for International Institute for Integral Sciences. And there's yearly conferences that are done by, just in terms of different topics, but he's a molecular biologist by trade. He worked in pharmaceutical industry for years. And so his knowledge of cell development and so forth is very innate in him. So now with his musical abilities, what he's done is he's tried to see how the cells, react to different frequencies and so forth. What he's offering now is that he's been put into not emergency room, but in surgeries. And they even brought him with his piano to come into the surgery during the surgery, and offer sound, it's more musical, sound healing during the surgery. So it is slowly happening. It's just
What's his name again?
Emiliano Tasso. I'll put his website up with in the chat. Okay.
Cool. Excellent. Yeah.
But there is that, that's happening. It's just how to, I wouldn't mind if people are sound healers to go into, surgeries, because we do know how, certain just doing that can help with, whatever the intention. I mean, there's a lot that's at play when you're doing it on that level, because you're putting intentions, you're working.
No, I wouldn't. Yeah. Well, I don't think I'm going to bother.
Kitty, I'm going to mute you again. Please stay muted. Yeah, Well, I've actually got a whole series of CDs for pre-op, during surgery, and post-op as well that I did with a guy at UC Med Center who's who works with orthopedic doctors there. So yeah, there's very cool. Okay.
David, I love all of this. It's just like so wonderful. But I just have a question for you for like in between here and there. Would you consider, I'm not asking, I'm just asking you to consider, like maybe like a group forum. So like there's so many brilliant minds here and they're sharing so much, and I'm taking in all kinds of different perspectives. And I would love, in between times, I'm sometimes driving around going, oh, the group, I would like to share this. And I just didn't know if there was a place where we could kind of like maybe add little things in between the meetings, and then I would be able to absorb some of like the experiences or the knowing of that other people have experienced.
Okay.
Would you be
We
open
already
to
have
that or
that set
consider it?
up. Actually, it's actually set up and working in the Research Foundation, but it's you have to be a member of the Research Foundation to access it. So what we're doing is making it, we're now redesigning the website so it will be free for everybody, and it can just be on, because it's actually part of the Medical Sound Association. Yeah, so we'll set that up. I mean, we could even, if anybody wants to help set up a Facebook group, we could start with that right now. And if you want to do that and then share it with everybody in this group, that'd be very cool.
Yeah. One thing I'd wondered about with the device I have, with what it does, it seems real powerful. And I've wondered at times if other healers work together. Let's say I've got someone, whatever it is, it's pretty severe, and I'm going to do some sessions. And do other healers ever work from their location jointly, kind of on a remote basis, just to add more power to that session?
Tell me more of how that might work.
Well, I've done remote sessions, basically, and there's crystals, lights, and all these sounds, on the table like they're there, but they're wherever they are. But I also thought that could help maybe bring more energy into another session that somebody's doing through sound.
I've done that, but I'd be interested in doing more of that. I whatever channel music from the other side and work with a pianist, and we would be interested in doing that. I'm currently getting ozone treatments for my fibromyalgia, and I'm using an energy healer. We've done him present in the room to combine modalities as well as long distance, and even the doctor can feel him. The doctor who I'm teaching all this to, who has had no experience, the naturopath has had no experience doing energy work. He literally could feel the energy in the room when I guided him how to settle in and be sensitive. So we know that the long distance does work.
Yeah,
of course.
it does.
Yeah, we do in the classes, we actually do healings on each other with sound. I mean, it's, you don't get the physical vibration on the body, which can be really cool. And tension totally comes across. Also, the electromagnetic field doesn't come across when you do long distance or distance as well. Electromagnetic field actually goes through the air in the room. So, but the quantum goes through big time, and that's the most important. So it's yeah. So this is what I mean, what would be cool is also if you guys have anything or come across any miracles. I mean, I've got a place on the website right now that it's called Miracle Stories, and where we can just post like stories. But and I think that can be really cool to really just educate people that this is really way more effective than they would ever think, right? There's another thing that can really help as well, and I've shown this before, but I want to show it again for those that are new, and that's in the Medical Sound Association, a couple of things actually. First of all, if you go to the medicalsoundassociation.com and go to intake forms, you can actually put in a treatment. And on a scale of 1 to 10, oops, missed. Let me fix that. On a scale of 1 to 10, what is the symptoms for different issues, right? And then the severity of the treatment, and then the what you used, and then the severity afterwards. And this is being collated in real time. So we now have, if we look at the reports, we can look here and go, okay, we've got 77 samples so far. And overall, we've got a 71% reduction in symptoms. But you could actually then, on this page, you could actually put in the actual health concern. You could say, okay, anxiety. Okay, let's filter it for anxiety. Okay, for anxiety, we had 40, and it's a 72% reduction. Or you could do it the opposite way. You can say for tuning forks, right? Or anxiety for tuning fork. What's the reduction, right? So this is really good data that you could use on your website to inform people. And also, if you do treatments, to put it in here, because when we get to the point where we've got 10,000 samples here, right? And it's going 70% reduction at 10. I mean, 70% reduction is way beyond what people are normally getting with allopathic methods, right? Often, right? So this, and not to mention side effects. So that's really cool there. One other thing while I'm here is if you click on integrative sound and scroll down, we now have treatment plans for grief, anxiety, depression. These are what we did in some of the meetings here and what our students worked on for PTSD, dementia. We don't have the addictions not posted yet. And we just did a treatment for schizophrenia. And and I want to put in here pain as well. So it's a really cool resource. And with each one of these, there's a lot of detail, like all the different types of anxiety, right? All the different symptoms, the causes, the current treatments, medical treatments, intake questions you might use, the overall conceptual framework and safety guidelines as to what you're going to be, how you're going to approach it, and then the details of treatments that people have come up with, right, for each one of these. So this is a huge database now that you can really use in your work now. Oh, and homework as well. The miracle stories, I'll email it. Let's see. Let me see if I can find it here. Let's see, miracle stories should be in the school section. And healingcenter.com/ I think it's just miracles. If I put in miracles. Oh, there it is. soundhealingcenter.com/ miracle. /love/miracle. They got all these here. This is very cool. His name is Michael. Email me about it. Chat. Okay. So would anybody here be interested in one of two things, which are kind of the same? Setting up a research center or helping run a research center, which will be bringing in people as well, but also working on a research project in this area. So basically, what I'm thinking is the Center for Sound and Pain, right? Or you might have to change it to Sound and Alleviation of Pain, but whatever. And then we start doing research in exactly what we're talking about, because I think within 6 months, it would have to be here to start, right? So we'd want to have it by the school, but we could have if people wanted to do outreach centers, we can at least start working together. I don't know if we could fund all those centers, but let's see. Yeah, Barbara, you might send the chat to everybody instead of just to me. We do have binaural beats. And then we can, get data from any centers. I mean, if you want to just start working on pain and start, just like Barbara's doing, to still start feeding all that data to us, right? And then if you get a whole center going like Barbara, it's like maybe we can get you some equipment, right? So that you get a whole stream of people coming in, then it's like it might make sense to actually fan out. But I'm thinking first here in the Bay Area would be cool, so we can drive over or walk over and check it out and see what's up. If anybody's interested, in doing this research or helping with this, email me or just let me know. At Michelle. Yeah. Okay. Yeah. What's your last name, Barbara?
Spalding.
Okay.
Spalding, Barbara Spalding. Yeah, I have a lot of people with pain. I have people with nerve pain too, different types of pain. It's not just fibro.
Mm-hmm.
And anxiety, all the, the combination of all this stuff.
You'll be a good guinea pig.
Yeah, and I wouldn't, and since I've gone through it personally, and I wouldn't, I wouldn't mind helping with the research. I live in Florida though, so it's not gonna, if there's a way I can help you in that sense, but I live in Florida.
Cool. Yeah. Shannon asked, do they have to be in California? I just went through that in detail. It would be if someone has a whole center that's dealing with already running clients through with a lot of pain, then that might be.
Yeah,
cool to actually
I do. I have a few, but sound healing, especially in this area, it's very conservative. So it's tough to really get too many clients. My practice is building. There was an article in a magazine that came out about it, very brief. And I've gotten some business for them. And then you have other people who are, like buying bowls and playing out, in yoga studios. So I end up, when people start looking, doing research on sound healing, they end up calling me. So I've gotten some people that way. But it's not like, as busy as it would be in California or New York or somewhere where, people are way more open-minded.
Mm-hmm. Yeah. And then you get here and now people want to go straight to source.
Yeah. Yeah.
Right. Although that's not true. People in pain, it's kind of shocking that, the possibilities, what you can do if you're in pain is so limited, right?
Yeah.
People are really it's such an important area right now.
I do also suggest now, since it's become legal, CBD for people here, combining that too for their pain, because that does really well, especially for fibromyalgia. It's very effective for that. But the combination, I just feel like
Not all people.
the combination of different modalities is, amazing for
that's cool.
helping people. Yeah.
There's also, I had a guy that works in the CBD field. He was talking about, doing research to find the frequency of the CBDs and what they're doing.
Yeah. Well, different strains, what they don't tell you is when you just buy CBD, like over the, by some company, they don't tell you the strains of what it's good for. So it's just like cannabis, different strains are good for different things, you know. So a lot of people say, I had no luck with that, but because they're not using the right strain. But I would definitely be willing to do whatever I can do for you, you know, if you want to talk more privately, and have some suggestions for me in ways that I can help.
Cool. Okay, so any other thoughts about this? I want to tell you about our brain conference coming up.
I have something. I don't know if I'm able to share my screen, but I just wanted to share briefly another resource about frequencies being used as remedies, and some of them also being transmitted through sound. It's a relatively new site developed by a Russian scientist named Anton Fedorenko, who also works with water. And it's quite promising. It might be worth looking into some of what they have on there, because people have already developed some remedies. It's called infopathy. Infopathy.
Taffy?
Infopathy, yeah. So
Taffy?
No, hold on just a sec. So like I just did an example of a search here, for example.
You can share your screen if you like.
Oh, hold on a sec. Where am I? I have so many things open. Where did it go? Okay, hold on. Okay, so you see that? So they have different ways of putting energetic frequencies, of exposing the body to energetic frequencies. They can imprint water. The search I did just right now, see I highlighted audible. So those are frequencies that are put in by an actual device called the Hummer that you put on your body, and you can put it anywhere, and they transmit audible frequencies. So these conditions that are here, and there's pages of them, like breast nodules and fibrocystic disease, cataracts, cervical disc regeneration, and it's saying what frequency they're using. And that frequency can be put into the body by this little speaker type device that you can wear. It has like a belt on it. And then you can do like searches by different systems over here, all sorts of things, mental health as well. And it's a really cool resource. And then you can even like make your own remedies. Like you can put things together, and it's all like transmitted like electronically through this website, I believe. So it's pretty cool. And the guy who's involved in making this is a pretty advanced person, I'd have to say. He's a physicist, and he's also got, you know, great visionary type of orientation. So
it's really great. It'd be great to get in touch with him and see what his thoughts are on it, as far as, you know, how to get precise about it. Because, you know, I mean, if you go to electroherbalism, there's also like tons of frequencies for all different types of parts of the body. And a lot of those are electromagnetic though, but not all. There's a lot of frequencies, but really what I'm really interested in is how did they do the research? And let's talk about it, right? So you can really,
I believe the contributors to the different remedies on this site, there's like different contributors. So it's like an open source site.
Yeah,
so
the Hummer's been around for a long time. My friend has one.
Oh, yeah. I just want to ask, because, you know, there's another company, it's called Good Vibrations near me, that's doing all this. They have the little speakers, you know, you put on you, and they play different frequencies and music. And I asked them, you know, well, where did you get these frequencies? You know, how do I know? Because I'm a big science person, being, you know, a medical background too. And they're like, oh, well, they're channeled. And then like with the COVID thing, they're like, we're not going to get COVID. We don't use masks. Because we have these frequencies. So we know that we're safe, you know? And I'm like, well, have you done any research on that you're claiming that? Well, no, you know, we just know. So a lot of these companies that are coming up with these things and have these different frequencies that they're saying are working, for different things. That's the question. And David, you're right on. How'd you do your research?
Yeah.
Where are
No,
they coming from?
I hear it all the time. Anytime and there's so many, even not only sound devices, but also electromagnetic devices. And it's like somebody says, "Oh, have you heard about this?" I'm like, I like immediately go, "Well, are they going to share how they did it?"
Right.
And or what their framework is for understanding how frequency work. Are they using combinations of frequencies? Have they even thought about using musical flows? I mean, it's, yeah. So,
and then I have a question too about all these electrical things. So do you remember that they were saying that electric blankets can cause cancer because you're having this electrical frequency in your body, even if, they're not really on, but you have them on you and you're plugged in? So how do we know with all these different electrical frequencies that people are coming up with that isn't the case? Again, that confuses me or concerns me a little when you're talking about electricity into the body.
Yeah, I think most of them, that people are putting out are doing good, right? Or they, because I mean, it wouldn't last very long if they're really hurting people. But how much good for the money? Elizabeth, tell us about that textbook. What is there? I assume coming from you that there should be some science in that book of vibrational medicine.
Yeah, he did a brilliant job really assessing the field of moving from a Newtonian understanding of medicine into an Einsteinian vibrational quantum understanding of medicine. And it's a thick volume. And he catalogs all the different vibrational medicines. And there's to your point that you just made, an excellent chapter on the vibrational technologies that we use to date. So he will break down for you what is an MRI. That's a resonance technology. Ultrasound, by the way, HeartMath is a resonance technology. That 0.5 frequency is when you hit a specific resonance in the human body. So HeartMath, HRV is a resonance technology. Ultrasound, physicists who brought us the understanding of ultrasound, many people have said, hey, if you can use ultrasound and diagnose these tumors, which are errant wave frequencies, why can't you invent us a machine that just goes in and fixes the frequencies? Why are we going in with a knife? And we all have seen the videos of healers that can do that, right? So we're in the place of seeing all these things happen. And what Gerber's textbook does is he starts to close that gap, close that bridge a little bit more about this is as far as the science has gone. These are the actual technologies that we see in the field. And then these are all the things under development. And the last thing I want to mention is Kirlian photography, because the ultimate goal is going to be, and I've heard many people mention this, is to map the pathways of energy. And sound healing is an energetic. It's a vibrational medicine, right? We are a world of waves, sound waves, light waves, all waves. How do we map and understand these waves? So Kirlian photography has been the closest we've come to being able to map these waves. So that's a little summary. Obviously, I love this book. Someone else commented they love it. It's really inspirational. It creates a wonderful umbrella, and you'll find yourself in there and be able to reference yourself across to many other areas.
Cool. There's systems that are way better than Kirlian that do something similar. There's a Syra system, the ASYRA, that gives you like a Kirlian readout of your entire body and all the different auras and chakras. That it's really incredible because they're actually sending electricity and pinging the different cells in the body, looking for the amount of water in each cell when it bounces back.
I should add, it's a 2006 or 2008 textbook. So in the last
Oh my
13
God.
years, things have happened, and you're probably naming one of them.
Oh my God, it's like if it's not updated for the last 6 months, it's and the way things are going now. Huh? Okay. Okay.
Yeah, I wanted to add one thing too. Are you
Mhm.
all familiar with the Zyto biofeedback system?
How do you spell it?
Z
Oh,
Y.
Zyto. Yeah.
Yeah.
ZY. Yeah, absolutely. They've been at my conference many times. Yeah, they're very similar to the nutrienergetics and to the actual the SCIO, where they actually send quantum numbers through the body and ping different organs and give you a medical readout. But they also have a sound device that you speak into that does voice analysis as well. And they use a combination. And I've used it, and actually it was really helpful to actually release like negative energy towards my father. It was like quite profound. And but it's like, oh my God, 15,000, then you have to pay a monthly fee as well. Yeah. Yeah. So speaking of Jeffrey Thompson, yeah, Jeffrey's been doing some incredible research around the brain. And he's like, I just interviewed him for our Sound and Brain conference, or not interviewed him, but actually he did a presentation as well. Elizabeth Elizabeth Krasnoff is a presenter for that conference as well. She just did her PhD paper on binaural beats and brainwave entrainment. Right. And then we got all these people that are doing some amazing things with the brain. And the conference is May 20th to the 23rd, and it's free. So it's like 16 different presenters. And I want to play my little marketing demo thing for you, just to see what you think. Okay. Because I haven't played it for anybody yet. Okay. Check this out. Let's see, let me find it. Okay, here we go. You know what? Let me play a higher quality version. Seems a little granulated. I'm going to close this one and play the other one. Okay. Here it is. Right here. This one's better quality. Okay. Got to change the dates. The dates are actually May 20th to the 23rd now. We just added a few more people. Okay, any final comments or questions or anything?
Yeah, hi, I'm
Mhm.
Barbara Murray. Just wanted to just shortly chime in as a layperson who has survived fibromyalgia, spent about 20 years going through that. And one of the greatest things I did was I spent 2 months down at La Jolla Pain Center. It was before fibromyalgia was identified.
Mhm.
So I had to go through that whole process of testing and all of that. But what I found most helpful was when someone is in chronic pain, you tend to disassociate from it. And it was very helpful. They had me do a inventory of my body when I woke up and kind of reconnect myself to my body, because you tend to separate. And also the most helpful things were hypnotherapy and meditation, because if you can get your focus distracted from the pain and then use color imagery or whatever imagery, it really does help the person get in a place where they can actually help the doctor in treating them, and getting to a place of acceptance of where they're at. Was really, really beneficial.
Cool.
That's all. Thanks.
Thank you.
David, it's Jacqueline from Winnipeg. Two things, just to let you know, on your video that you showed, it was very beautiful. Right at the end, you have the website across in yellow.
Uh-huh.
It kind of disappeared and I couldn't see it. And then when I could see it, it didn't give me time to record it. So I just don't know if you're still in the editing phases, if you might consider a different color for that.
Okay, yeah, I looked at it and I calculated that, but I'll take a look another way.
The other question I have is, I'm assuming you're familiar with the Monroe Brain Institute. I think they've done the most on the binaural beats. We have a meditation school here with a teacher from Monroe. So we've been using all of their current research materials. I've been working with it for 13 years, and degree meditation and using the Monroe binaural beats has, done amazing.
Yeah, we have 2 people from Monroe presenting.
Okay, great.
Yeah, of course, Robert Monroe died a long time ago. We do have someone from Sacred Acoustics that I just recorded as well. So we do have them, Karen Newell from Sacred Acoustics. Cool. Okay, any other final comments before we end?
I think you touched on one thing, David, I just want to reiterate, and that's you know of somebody who's doing research on finding the frequencies of the CBD. And I know that there might be something we might want to look into in terms of looking into the frequencies of different things that are being used and why they might work.
Cool.
Other than CBD, there's lots of other things people are doing.
Right.
Thank
Cool. Very good.
After watching the promo, David, it's really, it's fantastic.
Cool.
And it really brings home in pictures what I'm studying and what I think is so important for all the brilliant work that everyone here is doing, that ultimately we're working on the nervous system. And ultimately the brain is the part of that nervous system where so much of this healing can be done. Obviously, there's the peripheral nervous system, the PNS, when you're going out to the organs and to the specific places of unease in the body. But the center of that nervous system is the brain and spinal cord. So I think this is a huge shift and a really excellent locator for this work, to put it right there in the brain. And yeah, and I thought that the way that you did the promotionals make it really accessible. So everyone can start to understand, oh, I am actually changing the brain not just the peripheral organs.
Right, right. You know, I have to tell you, Elizabeth, in her PhD paper, she checked out all of the clinical research in the field that's ever been done and weeded out the ones that are kind of just woo-woo and really focused on the main ones, which was about like, you know, a dozen or 15 or so, I guess. And then looked at exactly how they researched it and the data. And she found that it's just a complete mess, right? There's no consistency. There's like people are actually, sometimes they're even measuring things for the wrong brainwave state, like, you know, measuring presence for theta, or but there is some good research, because, you know, if you look online, you'll see things where they say, are binaural beats really effective? Well, there's been a few that aren't really effective, but the research wasn't done in a cool way. And the ones that are done in cool ways are showing very cool results. So it's, yeah, so it's like the best presentation on exactly how to use binaural beats there is.
Thank you. Thank you.
David, is her PhD thesis available for us to read?
I don't know.
Yes, it's going to be published. I'm making it, what is it called? Open source, because I want all the information available. So
Could you put it in the chat?
it will be available open source. And I believe that will be in about a month, in about exactly a month from now.
Cool. Yeah, and
David,
of course, she
there's-
goes through it in detail in the actual presentation for the conference.
I'll
David,
put my
one more-
email in the chat.
Great. David, there's one more thing. I don't know. I know you're making a list of things that we're coming up with, and I don't think we discussed grounding. And when I saw the gal hugging her dog, I remembered I was being tested. I had a biometer on me at the time. My dog walked by, and all of a sudden, all of the resistance that I had went down just by touching him. So, you know, maybe we should also take a look at that when we're doing our research.
Cool, cool.
I have I don't know if I'm unmuted. Yeah. It would be great to have a place or list of the types of data that would be most acceptable and help further this movement of documenting sound healing for the medical community. I mean, we've all got our own ideas, but it would be nice if we could figure out, have a list of concrete ways, like not every person has to design their own research. It's like, we need this kind of research. Does anybody want to do this kind of research? And this is, you know, the type of data we want to collect from it. And these are the parameters, so it doesn't get mixed up in everything else.
Yeah, that's what we're doing here. In each of these presentations, are you saying you want a place where that's, you know, what we've come up with as far as the research that we should be doing? Because I have put it at the bottom on the Medical Sound Association. I put some of them. I put the research to be done. Is that what you're talking about? Just a list of research?
I'm going to be doing research on the vibroacoustic table that I have, lounge that I have, on anxiety specifically. But if I add,
oh, you're talking about a place for all research papers?
No, not for papers, for people who want to do research but don't necessarily know the best way to proceed in order to really further the movement in the medical community.
I'm not following. What is your, so you're wanting to a resource on how to do research papers? Is that what you're talking about?
No.
I'm not sure. I'm not following. I'm not.
Like,
Tell me more.
Since I'm going to do, I'm doing research on the effects of vibroacoustics on anxiety. But if I add anything else to it, you can't just document the effectiveness of just vibroacoustics on that, because everybody has their own system. We can't, it's hard to document when one person does vibroacoustics and tuning forks, another person does vibroacoustics and singing, another person does singing and tuning forks, another, finding a way to narrow the parameters so that when we collect data, it's something that can be repeatable and provable.
So why don't you just do vibroacoustics only?
Well, I can do that. I'm just wondering if anybody else is having the same um, idea that it would be great to have a list of things that we want to collect specifically, as opposed to being mixed up with multiple modalities.
I think I get it now. You're saying like a list of the well, yeah, it's kind of, the list is the Medical Sound Association. That's where we show all the different issues, and we could add to that and all the different treatment types, right? That I was showing earlier. It seems like that's maybe what you're talking about. So I'm sorry.
Yeah, I think it would be more about narrowing how the research happens so that you get a clear idea of what's being effective, as opposed to combining 3 or 4 modalities together.
Yeah.
You know, which did which.
Yeah, well, as we talked about in the beginning, and go over it again, is by doing multiple things at once, and you get data as to which one's the most effective, then you narrow to that. And then, so if you're working on, you find that this Tibetan bowls work, then you can start working on a whole range of Tibetan bowls, and you narrow it down to a certain frequency of Tibetan bowls. And then you can maybe do different types, so you get more and more specific. And that's a way of doing it, as opposed to just doing willy-nilly, like, okay, let's just do this one thing and one frequency and see if it works, because there's 20,000 frequencies. That's the way I was thinking, to narrow it down, which means it will be down the line before we get to more specific things that we need to data on. Like we could do, certain instruments, but we need to know what those instruments are the best for. And so as we go and do this more general research, it will get narrowed. And then I think we'll have exactly what you're talking about, where we can say, okay, we're looking, and this is good, because what you're saying is really cool, because when we get to the point where we can say, okay, we're putting out, this would be excellent. In fact, we can put out, once we figure out what we really want to focus on with a particular instrument or particular issue, we can say, okay, anybody doing research with vibroacoustics on anxiety, please submit, which we have a place for that, but it could be way more detailed. Does that kind of make like what?
Yeah.
Okay, cool. Yeah, no, I think that's good. Ultimately, that would be down the line for this association as we really refine things more and more.
Thank you.
Cool. Okay, so let's do this. Go ahead and unmute, and let's send a sound for all pain on the planet, including your own. Okay. Nice. Thank you. If we get enough people doing that, we may not have to do any research at all.
Thank you.
Thank you. Yeah.
Thanks for your time.
Everybody.
Thank you.
Blessings. Blessings.
Thank you.
Bye-bye.
See
Thanks
ya.
for holding this
Bye.
today. That was wonderful.
Yeah.
Thank you.
Bye.
Bye.
Thank
Take care.
Thank you for being you.